Bruce Willis, the famous action hero whose action films has thrilled our lives since our childhood, has been diagnosed with this condition called as aphasia, which has compelled him to take a break from his acting career. This is really a sad news for him. So today, let's talk about aphasia. What's aphasia? The literal meaning, according to the dictionary, means the loss of ability to speak, especially as a result of brain injury or disorder. So aphasia is a speech disorder that usually hampers language expression and understanding. In simpler words, it means one cannot either speak at all or communicate because they do not understand what you said or because they cannot speak properly. It's a really devastating condition that steals a person's ability to communicate, making it difficult to write, speak, or even understand what others are saying. Many people do not know about aphasia, but it's more common conditions than the Parkinson's disease, cerebral palsy, or muscular atrophy. So what are the causes? It's believed that aphasia is caused by damage to the language center of the brain. The most common cause of aphasia is stroke, and about 25 to 40% of the stroke survivor acquire aphasia. The other causes include a brain trauma, infection in the brain, or brain tumors. Sometimes, it's also due to degenerative brain disease such as dementia. How aphasia impacts a person can differ based on the extent and site of damage in the brain, which is depicted by the prognosis area. The first one is broca's aphasia and the other wernicke's aphasia. Now let me tell you, every part of the human brain has its own function, and similarly, we have broca's area in the brain that has the function which helps to speak properly. The other is the wernicke's area, which is responsible for the speech understanding. People with broca's aphasia, sometimes called an expressive aphasia, for example, may eliminate the words and the from their language and speak in short but meaningful sentences. They usually can understand some speech of others because the damage is in the front part of the brain at the dominant side. Is also important for motor movements. People with broca's aphasia often have right-sided weakness or paralysis of the arms and the legs. For example, if you ask the patient, "What's your name?" he might write it well, but when it comes to speak, he might utter something very different out of the context. Like, "I live in Tokyo." So there's a speaking problem while the understanding part is unaffected. The other is the wernicke's aphasia, which is also called the receptive aphasia, meaning the person does not receive well, and if you speak anything in front of him, his brain will not be able to comprehend what you spoke. So there's an understanding problem here, whereas the speaking centers are okay. People having wernicke's aphasia may speak in long, confusing sentences, add unnecessary words, or create new words by themselves. They usually have difficulty understanding the speech of others. In the third type, or the global aphasia, both understanding and speaking abnormalities can be seen. So how do we diagnose aphasia? It is assessed and confirmed by a set of comprehensive language tests conducted by a speech-language pathologist. And these tests include studying speech, naming, repetition, comprehension, reading, and writing. Making a diagnosis may also include the use of imaging procedure to look at the brain centers, such as CT or the computed tomography. CT scan is an imaging test that uses X-rays and computer to make a detailed images of the body. A CT scan shows details of the bones, muscles, fat, and organs. CT scans are more detailed than just the general X-rays. MRI, or the magnetic resonance imaging. It's a diagnostic procedure that uses a combination of large magnets, radio frequencies, and a computer to produce detailed images of organs and structures within the body. The next one is the PET, or the positron emission tomography, a computer-based imaging technique that uses radioactive substances to examine the body processes. What's the treatment of aphasia? For milder form, treatment can be restorative, using the speech therapies to retrain the brain to recognize the words, speak, and write them. A complete recovery from aphasia is unlikely if the symptoms last longer than 2 or 3 months after a stroke. The goal of the treatment is to improve the patient's ability to communicate through methods that may include speech-language therapy, non-verbal communication therapy such as computers or pictures, and group therapy for patients and their families. That's all for today. Hoping this video was helpful to you all. And yes, we wish Bruce Williams gets better really soon. If you liked the video, do give it a thumbs up and leave a subscription down below if you haven't subscribed yet. Till then, made it for you.
You